Hello and welcome. Today I'll be sharing an in-depth analysis of Sutter Tracy Community Hospital, examining how it operates, serves its community, and integrates with the larger Sutter Health Network. I'll also discuss my practicum experience at the hospital and the professional skills I developed along the way. Healthcare facilities often function like small cities. They require careful coordination and strategic planning to meet the diverse needs of the communities they serve. Every decision from staffing to services affects not just patient care, but the overall efficiency and effectiveness of the hospital. Sutter Tracy Community Hospital is a not-for-profit facility located in Tracy, California, and is part of the Sutter Health Network. For decades, this hospital has played a central role in serving the growing and diverse population of San Joaquin County. The hospital provides a wide range of inpatient and outpatient services, including emergency care, surgery, imaging, maternity care, and specialty services through its partnership with the Sutter Gould Medical Foundation. Its operations are influenced both by the needs of the local community and by Sutter Health's broader commitment to coordinated patient-centered care. Today, I will take you through an overview of the Sutter Health Community Hospital, focusing on its history, mission, service area, customer mix, product offerings, competitive advantages, and operational environment. Along the way, I will illustrate how the hospital functions with the larger healthcare system. Sutter Tracy Community Hospital began as a small local hospital and eventually became part of Sutter Health, one of Northern California's largest not-for-profit healthcare networks. Over time, the hospital expanded to meet the needs of a rapidly growing community, enhancing its emergency services and access to specialty care. Sutter Health's mission, caring for our patients first and our people always, guides the hospital's strategic direction and role in the community. Understanding this mission and the hospital's history is essential because it demonstrates why the organization prioritizes high-quality care and community access. For context, in 2024, Sutter Health cared for 3.5 million patients, nearly 100,000 more than the year before. The system also generated $142 million in operating income, which allowed expanded access and recruitment over 1,000 new physicians and advanced practice clinicians. At a local level, Sutter Tracy supports its mission by maintaining 77 beds and managing over 35,000 emergency room visits each year. These numbers demonstrate the hospital's role as a vital access point for urgent care in the community. The growth of the hospital and the network directly support its mission, ensuring patient-centered care. Understanding these foundational elements allows us to explore how Sutter Tracy positions itself within its region. Sutter Tracy's strategic decisions are shaped by its service area, patient demographic, and service offerings. The hospital serves Tracy's approximately 100,000 residents and the surrounding areas within San Joaquin County, a region that is experiencing significant growth and rise in healthcare demand. The hospital's patients are diverse, ranging from infants to older adults, and including individuals with private insurance, Medicare, and Medi-Cal coverage. Referrals from Sutter Gould Medical Foundation clinics also form a critical part of the hospital's customer mix. Regarding services, or its product mix, Sutter Tracy offers emergency services, imaging, inpatient and outpatient surgical procedures, maternity care, laboratory services, and specialized care such as wound management. Its partnership with Sutter Gould Medical Foundation further increases access to specialty care in areas like gastroenterology, cardiology, and orthopedics. These elements, like population diversity and service variety, are crucial because they influence patient volumes, staffing requirements, and operational planning. Sutter Tracy's competitive advantage comes from its focus on being part of the Sutter Health Network and serving the local community. Network membership provides access to shared resources and specialty care, while the hospital's community focus builds accessibility for both privately and publicly insured patients. This combination allows Sutter Tracy to deliver high quality, efficient care while maintaining a strong competitive advantage in the region. The hospital's operations are shaped by a combination of external and internal environmental factors that influence what they are able to do on a daily basis. Externally, Sutter Tracy must navigate strict state and federal healthcare regulations, changing insurance policies, and ongoing workforce shortages across California. Funding cuts at a federal level shift reimbursement models and also affect what services can be expanded or prioritized. In addition, community expectations continue to rise as patients want timely care, modern technology, and shorter wait times. The hospital also has to respond to population growth in Tracy and regional competitions from other healthcare facilities, all of which shape their strategic decisions. Internally, the organization faces operational challenges that directly impact how effective they can serve their patients. Issues such as staffing levels and department communications, and whether or not certain roles are union or non-union, influence everything from scheduling to workload distribution. Salary limitations, turnover, and the need for more frontline staff compared to upper-level management can strain departments and slow the workflow. Collaboration with Sutter Gould Medical Foundation clinics, as well as internal workflow processes, determine how smoothly patients move through the system. These environmental factors matter because they guide how hospitals allocate resources, plan strategically, and maintain quality care. External pressures influence funding, compliance requirements, and community expectations, while internal conditions demand operational efficiency and the overall patient experience. Together, these forces shape the environment in which Sutter Tracy operates, affecting both staff performance and patients' access to safe and timely, high-quality care. Let's look at current operations from two perspectives: providers and patients. For providers, the workflow moves quickly and can feel demanding. They're constantly managing documentation, communication with different departments, and coordinating with their support teams while still trying to give each patient meaningful attention. When the hospital gets busy, it becomes harder for providers to keep up, and even small delays can throw off the rest of the day. A slow lab result, a room not opening on time, or a scheduling conflict can affect everyone down the line and create stress throughout the department. Providers also feel the pressure of high patient volumes and may wish they had more time to spend with each patient than their schedule allows. From the patient's perspective, their experience starts long before they see a provider. It begins with trying to make an appointment or getting a referral, then arriving for registration and figuring out where to go next. Many patients now use tools like My Health Online, which helps them book appointments, review instructions, check lab results, and look at other visit information. This helps give the patients more control and help them feel prepared and connected to their care. Even with these online systems, some patients still feel like it's difficult to secure appointments because so many people need to be seen, which can lead to increased frustration and anxiety. Depending on what they need, a patient might visit several areas in one visit, such as imaging, labs, or specialty clinics. When communication between these departments is smooth, the process feels organized and clear. But when information doesn't move quickly or accurately, patients may feel concerned or overwhelmed. Workflows are also improved through advanced technologies like electronic health records. Electronic health records are becoming faster and easier to use, helping providers chart more efficiently. Some departments are beginning to use AI-supported tools that assist with routine tasks or documentation, which allows providers to spend more time in patients' direct care rather than sitting at a computer. These changes are designed to support both staff and patients by making the entire system more coordinated and less stressful. Understanding these workflows shows how layered hospital operations really are. Providers depend on efficient systems to manage their day, and patients depend on the same systems to move through their care without unnecessary stress. When communication is strong and processes work the way they should, both patients and staff have a much better experience. During my practicum at Sutter Tracy Community Hospital, I worked on two main projects: the electronic case request workflow for gastroenterology procedures and the American Spine Registry Data Management Project. For the e-case request project, I began by observing the existing paper-based workflow at the GI clinic, identifying inefficiencies and delays. Working with my preceptor, I helped implement a pilot electronic workflow process in Epic, taught the physicians and staff how to enter requests, and ensured submissions reached the same-day surgery center at Sutter Tracy. I also maintained tracking templates, monitored ServiceNow tickets, and updated educational material to clarify the workflow with staff. For the spine registry project, I reviewed patient charts to validate documentation and improve data accuracy for reporting. This proactive approach helps the team address gaps and enhance registry submissions. My contributions had a direct impact. The e-case workflow reduced administrative burdens, minimized errors, and streamlined case submissions. Involvements in the spine registry ensured accurate reporting and compliance, supporting informed decision-making. Overall, my work strengthened workflow efficiency, data accuracy, and patient quality care. My practicum experience allowed me to apply coursework and meet several course learning outcomes. For course learning outcome 1, I developed plans, defined problems, set goals, and evaluated results by piloting the electronic workflow and analyzing the spine registry data. For course learning outcome 2, I assumed a leadership role, coordinated workflows, tracked issues, and ensured smooth project execution. For course learning outcome 3, I applied professional standards, teamwork, and time management when teaching staff, prioritizing tasks, and collaborating with my preceptor. In course learning outcome 4, I considered professional ethics and technology while managing patient data, maintaining privacy, and resolving discrepancies in workflow. Finally, for course learning outcome 5, I participated in the profession through advocacy, lifelong learning, and professional involvement by improving the workflow process and supporting patient care. Overall, this practicum bridged clinical care and informatics while strengthening my leadership, collaboration, and project management skills. In conclusion, Sutter Tracy Community Hospital demonstrated how a community-focused healthcare facility can balance patient-centered care, operational efficiency, and organizational growth. Its history, mission, and strategic decisions reflect a commitment to serve the diverse needs of Tracy and the surrounding San Joaquin County population while maintaining high standards for clinical excellence and specialty care. My practicum provided firsthand insight into how these elements come together in practice. By working on the electronic case request workflow and spine registry project, I gained valuable experience in workflow optimization, data management, and interdepartmental communications. This all contributed to improved patient care and staff efficiency. This experience reinforced the importance of collaboration, problem solving, and continuous learning in healthcare. It strengthened my professional skills, expanded my understanding of healthcare operations, and prepared me to contribute meaningfully to the field of nursing informatics. Thank you all for your time and listening to my presentation.